Good morning, everybody. Thank you so much for joining us today. This is going to be the first of 3 webinars we are doing to talk about the 2020 United States Conference on HIV and AIDS. Why we're doing these is to give you an opportunity to experience some of the platforms that we're going to be using and to look at how distance learning does or doesn't work, and for you to give us some feedback. The primary purpose of today's meeting is going to be divided into 3 sections. The first section is going to be me talking about the content of the meeting. The second section is going to be Tara talking about the platform and how you can use the platform. And the third section is going to be, we're going to be asking you for your input and asking you, what do you want to see at this year's meeting? How can we make sure that this year's meeting is a good experience for all of the attendees? You should know that within the first 24 hours of putting up the registration, we had over 1,200 people register for the conference. And so it has been extremely busy and extremely full. But before we get started today, what I'd like to do is a little technical assistance session. On your right-hand side, you should see a little control box that says Go to Webinar Control Panel. In that section, you should see a thing that says Questions. What I'd like you to do in that question box, if you don't mind, so that we could just know who's on, is if you could type your name and your city, and if you work at an AIDS organization or an HIV, if you could write your organization. We would like to know who's on the phone today. So, Chip, have we started to get some names down? Come on, people.
Yes, we have. We have Alberto from Miami Beach. We have Quaniki, and I'm sorry if I'm mispronouncing the name, Quaniki Martin. We have Glenn Pruitt from Rehoboth Beach. We have Jeff Walker from Searcy, Arkansas. Gary Daffin from Boston, Multicultural AIDS Coalition, Frank Montenegro from Proceed Incorporated in Elizabeth, New Jersey, Latasha Watson from Jackson, Mississippi, Mississippi State Department of Health. Lots of folks on this morning.
Great. Well, so what you should know is that we're going to be using that question box a lot. And so if you have any questions that you want to be asking us, please feel free to do that. You're also going to see below that a chat section. And if there are any issues that you want to just ask everybody, you can put it in your chat section. We will have staff who will be monitoring the chat so that they can answer your questions. First thing we'd like to do is tell you a little bit of the truth. This is our first time doing this. In fact, this is probably the first time that most of you have been to a virtual conference. And so it's a new thing. And so we are learning. We are not experts, and I don't want to pretend like we're experts in this. What I want you to know is that we are working as hard as we can to shift and make this a good learning experience for everybody. And so what we'll do now is let me just have the staff, well, some of the staff from conferences introduce themselves so that you get to meet them. And Chip, if you could put their email addresses in the chat section so that everyone could have them accessible to them. So Tara, do you want to start?
Sure. Good morning, everyone, and thanks so much for joining us. I'm Tara Barnes-Darby, the Director of Conferences at NMAC, and this is also my first virtual conference, so thanks for entering to this foray with us. Allison?
Good morning. I'm Allison McKeithen, the conferences manager. Again, a newbie to this virtual platform process, but I'm excited to go through this with you, and I hope you're all excited as well. Thank you for joining us.
Great. So I am going to share my screen and walk you through a brief presentation that will look at how we hope to do this year's conference. I'm hoping everybody can see this and that it's moving. Tara, can you see it? Good.
I can see it and it's moving.
I'm assuming she said yes, because yesterday we did a practice run through and it wasn't moving, so that's why I'm doing this. This is the conference. It is going to be happening October 19th through the 21st. There are a couple of important things to note here. The first is that even if you aren't able to join us on those dates, the conference will be put online so that people will be able to access the information afterwards for the next 12 months. So we hope that even if you have to miss a workshop, you can catch it at a later date, or if you forgot something at a workshop, you can catch it at a later date. We're also doing that because it will allow people to be able to have the greatest amount of learning that we think is possible. So what I want to talk to you about is the fact that COVID-19 has changed the world, and we know that it's changed the world. And what we want to do is lean into how that change has impacted the provision of HIV prevention, care, treatment, and wraparound services. We also understand over these last few weeks the impact of Black Lives Matter. And so we want to pivot not just into talking about how COVID-19 has impacted our work, but we also want to pivot to talk about how Black Lives Matter has changed how we should be and how we are looking at the provision of services. So what you should know is that the virtual conference will have 5 plenaries, 60 workshops, I said 12 institutes, but it's probably more likely 20, and a virtual exhibit hall. And yes, we are being extraordinarily ambitious. And there are times when I know staff looks at me and said, "What have you gotten us into?" And we did this because we felt like if we're going to do it, if we're going to try to train people, let's get everybody in. And the other thing that we wanted to do was, we know that so many people are sitting at home in isolation, and so we thought this would be a good opportunity to reach large numbers of people. The other piece on this that's important to understand is that we're going to be doing for the first time a virtual HIV jobs fair. And part of what the virtual jobs fair is about is that there are over 40 million people unemployed in America right now. You know, there are many nonprofits who unfortunately had to furlough or lay off staff. There are many people in the community who find themselves without employment. And this is at the exact same time that the HIV community is about to see $300 million in new funding to end the HIV epidemic. And so we feel like that will be thousands of new jobs and hundreds of new contracts for CBOs. And so we want to use this technology to bring together the people who have jobs with the people who need jobs. And so if you know of anyone who is looking for employment, particularly employment within the HIV field, please encourage them to come to the jobs fair. Tara will talk to you about how we will be doing that online so that people can both download job applications as well as upload their resumes and schedule information interviews. The big thing that we did this year that my board thought we were crazy is that it's going to be free for the first 4,000 registrations. And let me be really honest about why we did this. We did this for one reason and one reason only. Everyone's broke. You know, everyone's having a really tough time right now. And it just felt extremely tone deaf to ask people to pay a registration fee while nonprofits are hurting, while people are unemployed. Now I will say this though to all of you, we are free, but you're going to be getting a donation request from NMAC. And we sincerely hope that you will make a donation, particularly if you find the conference to be of value. But we didn't want money to be a barrier to people's participation. And the only way that we were able to make that happen was because our sponsors decided, or were gracious enough to keep their sponsorship fees the exact same, even though we're going to a virtual format. And so we are extraordinarily thankful to all of our sponsors who continue to support this important meeting. So the focus of the meeting is going to be on COVID-19. And like all of us, including this meeting that we're sitting here in front of you with, it's changed the way that we work. It's changed the way that we provide services. It's changed the way that we're working to end the epidemic. But yet, not all of us have a similar understanding of what those changes mean. And so we thought it would be important to bring everybody together to have a dialogue about, so what are you doing around HIV testing right now? So what are you doing, and how is COVID-19 impacting the provision of housing? How is it impacting the provision of food services? How is it impacting the provision of all of the work that we are doing? And so we'll be talking later about abstracts, but if you have any good thoughts or have any programs that you think should be highlighted, we sure would like you to submit an abstract, because we are a movement that is really looking for answers right now. That's not unique to HIV. I would say that's everyone in the world is looking for, how do we do our work in an environment where we don't have a vaccine and we're still not at a completely effective treatment. So the theme for this year's meeting is Family Reunion 2. This was a theme that for those of you who've been to USCHA before, this was a theme that we used 2 years ago in 2017. We decided to come back to this theme because right now we need our family. Right now it's a little scary. The world feels upside down. And so we thought that Family Reunion would be a good reminder of who we are as a movement. I also want to say that family is much more than your blood. Family is the people that you want to hug when you should be socially distant. Family are the people that you create a path with to help you get through these difficult times and to help you understand kind of, what does COVID-19 mean to my work? What does Black Lives Matter mean to my work? How are these kind of intersection of multiple challenges going to change the way we do HIV services? And how can we do it and give virtual hugs to each other? So let's talk a little bit about the plenaries. We are still in the formation section of our plenary, but I will tell you that there will be 5 of them. The plenaries will be 60 minutes long, and not to deceive you, and we want to let everyone know that they're going to be pre-recorded. And part of why they're going to be pre-recorded is because we're a little bit worried about this technology and going live. And so we're going to pre-record it so that way everyone will get to see the plenary when they're supposed to see it. We won't have any live hiccups. Well, we might, who knows. But we're trying to minimize the live hookups so that everyone can see it and view it. However, we should also know that if you miss a plenary, it will be online for you to revisit at a later time. The 4 topics that we have, the NMAC is doing 2 of the 5 plenaries. We're doing the opening plenary on family reunion, and that is where we're going to be talking about the intersection of COVID-19 and Black Lives Matter in the provision of HIV prevention and care and treatment and wraparound services. The closing plenary is going to be a federal plenary. This is where we've asked all of our federal partners to come and update us on what they think should be the next steps in our efforts to both end the epidemic, but also to just continue to provide services. I am very pleased to announce that Dr. Tony Fauci has agreed to keynote this plenary. And as you've probably all seen him on TV, he is so busy. And so I just thought it was really amazing of him to volunteer to do this. There will be 3 other plenaries. These plenaries are going to be done by industry. This is part of the package so that they would continue their sponsorship fees, and we are grateful to them. Gilead will be doing a plenary, ViiV will be doing a plenary, and we don't know about the 3rd one. We are working with a couple of companies who would like to do that. And we can talk with you about kind of the topics that you would like to see at a later time. So the workshops, this is the substance of the meeting. This is where we need your input, and what we'll be looking for at the end of this webinar is, so what do you want to hear? We really want to hear from you. And so as we move into the chat and questions section, we would like to know, what are the topics that are most important to you right now as you try to figure out how to work in this new environment? We're going to be doing 60 workshops. There are going to be 4 workshop sessions. There will be 15 workshops per session. Now, this is where it gets a little interesting. The first 30 minutes of these workshops will be pre-recorded, and we will ask people to present the data section of the workshop. The last 30 minutes of the workshop will be live, and it will be live Q&A, and we'll be doing 15 simultaneous live sessions during each workshop session. Wish us luck. I'm going to be honest with you, we're going to be watching a lot of people and seeing how that works to try to figure it out. We'll be talking a little bit later about how to submit abstracts and what we'd like you to do. These are the tracks for this year's conference. We're doing tracks on race, a federal track. We're doing HIV prevention during COVID-19, HIV care and wraparound services during COVID-19, the next steps for ending the epidemic, reaching communities hardest hit by HIV. We're doing something on HIV policy, something on community organizing. And finally, we're doing for the first time a Spanish language track. And we're doing this really as an acknowledgement to the fact that we should have been in Puerto Rico this year. And we really want to thank all of our colleagues in Puerto Rico for understanding that it was just impossible to go there. And we will be there back in 2022, and I'll talk about that in a minute. In addition to the 60 workshops, we're also going to be doing probably around 20 institutes. NMAC historically has taken responsibility for the institutes that look at racial and ethnic communities, as well as populations that are disproportionately impacted by HIV. So that means that, we'll do the traditional African American, American Indian, Alaska Native, Asians, the Latinx community, as well as Pacific Islanders and Native Hawaiians. But in addition to those communities, we've added a couple of new ones this year. The first one is for heterosexuals. Last year, we got a lot of feedback, and by feedback, I mean complaints. And by complaints, I mean people coming to my room and knocking on my door saying, we have to do more for heterosexuals. And we absolutely agree with that. And so for the first time, we're doing a heterosexual institute that is specifically going to look at heterosexuals living with HIV and how we can best address heterosexuals. The other new institute that we're doing is going to be on transgender men. We have for many years done something for transgender women, but similar to the heterosexuals, the transgender men in their important advocacy came to me and said, we need something specifically for transgender men. And we completely understand that. And we understand that the conference is both a place for all of us to come together, but it's also to meet within those communities that we find the greatest affinity to. And so when we get to the question and answer period, if there are institutes that you particularly want to think us to provide, please make sure to put it into the questions section. And then the final thing that I just want to let you know is that NMAC remains committed to Puerto Rico. We have rescheduled the meeting already. It is going to be October 10th through the 13th, 2022. Unfortunately or fortunately, NMAC had already signed a contract for 2021, and we're going to be in Washington, D.C. next year. And so that's why we're going to Puerto Rico in 2022. We're also going in 2021 because it is the start of either the extension of the current administration or maybe even a new administration. And so it will be an opportunity to figure out where we are going during this next 4 years of the administration. So that's it for kind of the the content of what we're trying to achieve. Let me turn this over now to Tara to talk a little bit about the substance of what we are trying to achieve. And then we will open it up to questions and invite all of staff to come back and join us. Thank you. Thank you, Tara.
Thanks, Paul. Can you see my screen?
No.
There we go. Can you see it now?
Yeah.
Okay, great. So hopefully Paul's conveyed our desire to have that USCHA energy that we normally have, but dealing with the reality of actually doing it virtually. So hopefully you'll see that in this presentation, we've made every effort to kind of have that energy, but also make it fun to kind of navigate the environment. So I'm going to walk you through sample platforms. So this is, this is basically just a mock-up. We're actually building out the actual platform elements this summer. So this is a virtual lobby. So, once you register and, a few days before the conference, you'll get your login credentials. And once you log in, you'll kind of come into this, virtual registration area or hotel lobby. And this will be the place where you can kind of get your bearings. It'll be a place where you can come to go to the exhibit hall, go to the plenary session, the workshops. It'll also be a place for signage and for, sponsor information. But what we'll do is we'll make sure that during the conference hours, there's an information desk. So if there are any issues with navigating the platform or with any other questions, there'll be someone staff there to answer your questions. And I also wanted to, highlight what Paul said. Before the conference, we'll have several webinars just kind of training everyone on the platform and how to navigate it. Okay. So this is what our virtual exhibit hall is going to look like. So it'll open up into a space where we'll have all of our premier presenters, but for additional exhibitors, they'll be able to be accessed by scrolling either to the left or to the right. You see the different arrows, and we'll have a search box where you can just type in the name of the exhibitor and jump directly to their booth. So once you're within the hall, this is what it will look like to actually visit someone's booth. The booth experience. So you're clicking on someone's booth. They've taken the time to upload certain things, things that they would typically have at an in-person conference, some brochures, maybe a video, information about the company. So as an attendee, this is what you'll see when you click on each person's booth. And of course, it depends on what they've uploaded. But it's definitely a great option to be able to download information as well as to engage. And how is that going to be done? Through chat functions. So there's ways to engage either one-on-one with the rep. You can speak one-on-one, with the person that's going to be there. They're going to be live exhibit hours where people will have representatives actually there at the booth to speak with you. Exhibitors can also arrange appointments. If someone is not there or someone's too busy or you're going to a workshop, this can all be done through the platform. And you can also have a group chat or a one-on-one video chat. Another thing about the conference, and that our conference bags are very popular items, but this year you'll have a virtual conference bag. And that'll be a place where through the platform, you'll gather all the information that you've collected through the conference. So that can be handouts, it can be exhibitor brochures, anything that's downloadable. So here's an example of a virtual conference bag. These are things that perhaps they've, picked up at an exhibit booth. This looks like a handout, and these can all be saved to your virtual conference bag and eventually downloaded outside of the platform. As Paul mentioned, we're going to have a virtual jobs fair. The format is going to be similar to the exhibit hall experience, but it'll definitely be a place for people to meet up, both those who are looking for jobs as well as attendees and organizations and health departments who have announcements. So there'll be an opportunity to post announcements, post your resume, set up an appointment for to follow up or to have perhaps an interview. So we're definitely looking forward to that. So on to the plenary session environment. So from the exhibit hall, you'll click on plenary sessions. And from the virtual lobby, you'll click on plenary sessions, and all of the labels that are in the virtual lobby will be clickable. So they'll go directly to those particular rooms. We'll also have a kind of like a navigation bar right here for you to just go directly to the place that you need to go. But you'll be brought into sort of this virtual ballroom, and it'll be a place where you'll be waiting for the session to start. But once the session starts, you'll click on the middle screen, and the video will expand to full screen, and the plenary session will start. As Paul had mentioned, it's going to be pre-recorded content. Next is semi-live breakouts. So as Paul has mentioned before, some parts of the conference, for the most part, it's going to be pre-recorded. But there are going to be some, we know that skills building part of it is important, and to have that engagement and be able to answer questions and to have that feedback with presenters. So we're going to have, the workshops will be 1 hour in length, 30 minutes of presentation along with live Q&A for 3 minutes. That's the term, semi-live. So here's an example of a conference. This is their virtual lobby and how they are accessing the actual workshops. So they're going to their auditorium, for USCHA, we'll say workshops, and you're brought up, you're able to scroll through a list of both on-demand content, those are the sessions that have already been recorded, and semi-live. And semi-live is basically those sessions that have not had their Q&A session yet. So it'll be a very easy way to navigate. And again, during the orientation of the platform that we're doing closer to the conference, we'll give a step-by-step on how to do that. And again, we'll try to make it, engaging and fun. So there'll be some gamification offered throughout the platform. We normally do this through the mobile conference app by having a leaderboard where you can gain points to win prizes from exhibitors and sponsors, as well as NMAC. So we'll explain more information on what the different games will be, but we'll have at some point a scavenger hunt. An example of, the scavenger hunt is right here. You'll see we've hidden an icon, a owl within the exhibit hall. So we'll explain in advance, what to look for. It can be a sponsor logo, it can be, a pineapple, it can be whatever. But we'll definitely, and it can be hidden wherever in the platform. So we'll give you some information on that, of course. So that people can gain points and get prizes. And again, that's not, the only, engagement that we're planning. We're also planning to still have our lounges. It's important to have our persons living with HIV lounge and trans and youth lounges. We're probably going to do that through Zoom Hangouts, and so that people can also see face-to-face. Have that connection, as well as some informal programming in those lounges. We'll have a networking reception, and we'll also plan to integrate social media. So that is the end of my presentation. So we're just going to open it up for questions.
Thank you, Tara. Allison, yay. Is Dante on?
She is not at the moment. So.
Okay.
Allison, could you talk a little bit about kind of how we're going to be doing abstracts? And Tara, stop sharing your screen.
So yes, hi. So this year for abstracts, we know that we started our process initially. Now we've relaunched, we've added the new tracks that you've heard discussed, and we're giving everyone who previously submitted an opportunity to review what they submitted previously, see if it fits into some of our new tracks. If it does, please select the track it best fits in and resubmit your abstract. We'd still love to see it and review it. If it doesn't, feel free to take this time to rewrite it or restructure it, or whatever topic you're dealing with now that fits into our tracks, please submit your abstract. We're looking forward to seeing those. And as always, I'm available. My email is in the chat box. Email me if you have any questions about those tracks, and we'll actually be doing a webinar next week to talk about the abstract process and the new tracks. So keep looking out for that to come through.
Great. So what I'd like you to do now is, you see the question section of the GoToWebinar control panel. If you could put your questions in there, and if you could put your name with your question, it would be really helpful for us. But let me just ask, so while you're typing your names in, let me just ask a couple of questions now to staff so that you get an idea. When are abstracts due, Allison?
Our abstract deadline is July 17th. So we have a few weeks left.
And where would they apply for it? Where would they do it?
Sure, the abstracts link is linked on our USCHA.life website. You want to click on the abstracts tab, drop down, you'll see submit now buttons. You can go there, you can review the whole process. There are even videos on how to submit and write an abstract there. And you can click there and they'll take you right into the system to write and submit your abstract.
Great. So Chip, do we have any questions?
Yes, we do. 1 second here. First question is, going back to the tracks and institutes, is aging with HIV being covered?
Oh, lots. There will be many, many, many things on aging and HIV. There's going to be a special track that's being put together by NMAC's Over 50 Living with HIV. So that will become an institute as well as a track of workshops.
Okay, next question. This is from Clyde. Can we have a workshop on incorporating COVID-19 testing with HIV testing?
If you submit one, yeah, absolutely. That's the exact kind of workshop that we want. And we're going to have to look to the field to ask all of you, how are you doing that? Because we think that that's really, really important. And so, yeah, that's the exact abstract that we're looking for.
Comment here from Glenn Pruitt. The work you all have done so far in developing the platform is incredible. Great job.
Thank you.
Another question from Glenn. You said that registration for the conference is free for the first 4,000 participants. Will there be a cost for people after that? If so, how much?
No, it's not about a free versus cost. It's about the capacity of the platform. And so one of the things that we're trying to do right now, because the numbers were so overwhelming, is figure out how many more people we can fit on here. But it's more about capacity and not about money. Next question.
Okay. Next question from Teresa Sullivan. Will there be exhibit abstract submissions?
Tara, I'm going to turn that to you.
Yeah, actually, I needed to clarify exhibit abstract submissions.
I don't know what that is. One of
All
the
right,
things,
Teresa, if you can clarify that in the box.
Yeah.
then
One
I'll
of the
be
things
happy
that
to
I will
answer.
say is that we are giving away free exhibit booths to each of the members of the 57 jurisdictions that are targeted for ending the HIV epidemic for free. And we're giving them free exhibit booths because we know that they're going to be the folks that are going to have the money from this effort. And so we want them there, particularly to share any job openings. We're also going to invite them to include community-based organizations or other organizations in their health jurisdiction who have job openings, because once again, we want to make sure that we can connect people together. Next question.
Teresa's clarified. She's talking about will there be abstract submissions for poster displays?
Oh, no, we're not going to have posters this year.
Okay.
Next question.
Next question from Kathy Augustine. Will there be anyone addressing the use of methamphetamines among HIV-positive individuals, as well as how it may contribute to HIV through IV drug use?
Yes, absolutely. Once again, these are the kinds of workshops that we really want to see at the conference. And we would figure that that would be part of the reaching communities hardest hit by HIV. And we, as you all know, as you probably obviously know, is that people who use drugs are a community that we need to make sure we reach. So yes, there will be. And we encourage you to submit an abstract for it. Next question.
Next question. We have any workshops about STIs?
That must be from David Harvey. And so David and NCSD, we want you to know that two things. First of all, we've offered NCSD the ability to do both an institute on STDs or STIs, as well as a series of workshops. So yes, there will be.
Okay, next question from James Lewis. When does registration start and what is the deadline?
So registration starts now. As I mentioned at the start, we had over 1,200 registrations in the first 24 hours. And we will continue to accept registrations until we get to 4,000. And then we're going to need to make another decision. And so I would strongly encourage you to register now if you can. It is free, and we had a little hiccup when we first opened up, but now I think it's a pretty easy process, and so I strongly encourage you to register now.
Okay, next question is from Corey Roroya, and I apologize if I'm mispronouncing the name. I went to a conference in Atlanta that was for Black women living with HIV, female sexuality, and healing racial trauma. They were amazing speakers like Dr. Gail Wyatt and Dr. Cheryl Grills. I feel like it was eye-opening and life-changing for myself. I was wondering if there would be anything similar available.
There is going to be an institute for Black women, as well as a track for how to reach the communities that are hardest hit by HIV. We obviously hope, and based on past experiences, I would anticipate that there will be multiple workshops on Black women. However, if you could either contact those women and ask them to contact us, we would love to have them be there, because part of what we want to try to figure out here is the HIV community is an extraordinarily diverse community, and our goal is to try to represent the diversity of that community, but it's only possible if we get abstracts. Next question.
Next question, do we know who will be leading the discussion on heterosexual and HIV issues?
Not yet.
Not at this particular moment. If you are interested in participating in it, let us know. We would love to have a lot more people involved, but predominantly the institutes, particularly on race, will be put together by NMAC's community advisory panels. And we're still working out the details with all of them. But once again, you have Tara and Allison's email address. Please feel free to email them directly and make recommendations.
Next question is from Jerome Stoner. Will there be any workshops or information to support ending the epidemic initiatives not identified in the federal plan, i.e. not part of 57 jurisdictions?
Yeah, there's going to be a whole track. We're working with HHS to put together the track on the next steps for ending the epidemic. My sense is that it will be broader than the 57 jurisdictions, But once again, we're looking for HHS to submit their data. We haven't seen all of it. And we also are waiting to see what abstracts come in.
Next question also from Jerome. What continuing education credits will be offered?
All right.
Allison's going to answer that one.
Yes, so we're looking to offer 3 types of continuing education credits through our institutions we've worked with in the past, such as social worker CEUs. We're going to offer chess credits, and we're also going to offer general CEUs through George Mason University. And we're also working with a partner to hopefully offer some CNEs as well. As we get those approvals, we'll post that information online on which sessions to attend to make sure you get those credits. But we will have CEUs.
Next question from Glenn Pruitt. Do you have a feel of what percentage of presentations previously planned will be carried forward into this virtual event? Are there many workshop slots that need to be filled?
No, are you referring to the abstracts that have been submitted already? Well, we hadn't gone through the selection process for the abstracts yet. So we were able to retool at a time because we hadn't made the selections. However, if you have already submitted an abstract, then you should have heard from Allison about whether or not you can retool your abstract to fit the new categories.
Next question from Joy Weddle. I registered for the conference. The confirmation email gives dates of October 21st to October 23rd.
Yes, that's been corrected. The correct dates are October 19th to the 21st.
Okay, that was me. I wrote the letter wrong. I'm sorry.
Oh, okay.
Okay.
We don't have any questions in the queue right now, but several people are asking where to register. So the website address is linked in the chat box right now, but it's USCHA.life is where everyone can register.
I also wanted to share some information for those who had registered previously for the in-person conference. Number one, if you've made reservations at the hotel reservations at the Sheraton or Caribe hotels, they will be canceling your hotel reservations and refunding your deposits within 30 to 60 days. So you don't need to call them directly to cancel. Additionally, if you've registered for the conference and paid, you should be getting an email from Shantae Gray today about how to either, what options you can do with that registration, either a refund or application to next year.
Or you can make a donation for this year.
Yes.
Any other questions coming in?
None at the moment.
Great. Well, Len, why don't we do this? Rather than keep everybody around, let's just say thank you so much for joining us today. We hope that this was helpful. What will happen after we end this webinar is you're going to get an automatic screen pop-up that's going to give you an evaluation. What we'd like you to do is fill out that evaluation, and please feel free to be brutally honest, because part of what we want to do for both ourselves as well as for participants is learn how to use these platforms, to learn how to use them so that we can be comfortable in them by the time the meeting happens. Because the reality is that for most of us, if not all of us, this is brand new. And so part of why we are doing so many webinars in advance of the meeting is to be able to train ourselves, but also to train attendees on how to get the most out of this format and to see kind of what tweaks we need to make. So for example, let me just ask one last set of questions because I have a few more minutes. What are the critical issues that you want to see at this year's United States Conference on HIV/AIDS covered? And what are the things that, if we don't have it, you will be disappointed? So if you can give us a little bit of feedback, that would be really helpful in terms of what are the pieces that you think would make this a good meeting? Any comments in the box, Chip?
Not yet.
Come on,
Let's give folks a couple of minutes.
And part of why we do that is that obviously we want a conference that meets your needs. We want a conference that speaks to the issues that you need, that you want to hear about. We want a conference that is relevant to your experience in working in the epidemic. We want a conference that is relevant to your experience in working to end HIV. And the only way that we can do that is if we hear directly from you. So anything, Chip?
Yeah, we have a couple. One is focus on social isolation.
Mhm.
Yeah, no, thank you. Absolutely. Yes.
Go ahead, Paul. Go ahead, Paul. We're getting some more in, but go ahead.
No. Okay, I was just going to say, I think for all of us, we are living this very odd life right now, and I particularly worry about how the isolation can lead to depression, and that out of that depression can come a series of things, and so particularly for people living with HIV who already suffer from that social isolation, and particularly for people over 50 living with HIV. And as Taz likes to say, for long-term survivors, we're very concerned. And so what you should know is a couple of things. For long-term survivors, we are going to be doing a separate set of USCHA things. In addition to the conference, we're bringing together another cohort of over 50 living with HIV, even if there's not a meeting, to help them put together a section of the conference that will speak directly to them. Any other questions?
We have several.
Well,
topics now. Oh, sorry,
Okay.
Paul. We have several topics that come in. Increasing Black and Brown people in leadership tracks and role.
Yeah. If you read my piece yesterday, so let me just speak to that one, because I think that's really, really important. Our movement is about to hire thousands of additional people with the new money to end the HIV epidemic. NMAC believes that it is critical and essential that we hire the communities that are highly impacted by HIV. Not only does that mean Black and Brown people, but that also means people from the transgender community. That means Black women. That means that we need to make sure that folks who live the experience can be a part of the programs that serve the communities. And that is a critical piece of why we're doing the jobs fair, and why we're asking organizations to bring their job announcements there. Because far too often we hear, well, we didn't have any qualified transgender folks apply for the job. Well, there are many, many, many qualified transgender folks. And so we just want to make sure that we can create a platform where the folks can meet each other and can have opportunities for these jobs. Next question.
Okay, sure. Next topic is how to reach and train physicians about PrEP.
Yeah.
Addressing bias and microaggression from PWI.
So I got an email. Wait. So I got an email yesterday from a physician in New York who was talking to me about the fact that they're really trying very hard to reach the Black community. And I think she was a little upset with my piece yesterday. And what I wanted her to know, what I want everyone to know is I don't think that she is doing something that is racially biased. But I think the results of where we're at are racially biased. And so we have to figure it out as a community. In other words, I'm not saying that that because you don't have people of color in PrEP that you're necessarily racist. What I am saying is that the results are racist and that we have a responsibility to be able to relook at all of these programs, because if we are going to end the epidemic, then we have to make sure that the uptake of PrEP happens around all the communities that are highly impacted by HIV.
Okay, we have a few more. Strategies to provide effective prevention and care in light of COVID-19.
I'm sorry, I missed that, Chip.
Sorry. Strategies to provide effective prevention and care in light of COVID-19.
Yeah, no, just so you know, we had a meeting just like this with HRSA. That was one of the exact topics that we asked that they address, both in the HRSA workshops as well as Dr. Cheever addressed at the federal plenary. Because I think a lot of us are trying to figure out what are acceptable interventions or programs that we can do given our federal funding, and how can we make sure that we are appropriately using those dollars and support. Next question.
Planning and executing projects to improve African American viral suppression.
Yeah. Yes.
50 plus sessions.
Yes. We will absolutely have a lot of
isolation, trauma, COVID-19, and intimacy issues.
Yeah, that intimacy issue one, I think is going to be a really difficult one. I really want to acknowledge the New York City Health Department for all of their very progressive and important dialogue about what does safer sex mean in COVID-19. And I particularly like their glory hole one. So yes, no, I think it's really interesting, and I think we're all trying to figure that one out. Next, please.
Discussions about U.S. Preventative Services Task Force A grade recommendation for PrEP.
Wow. We'll have to write that one down. I don't know enough about that one to be able to say whether or not we can do that. Once again, let's make sure you provide a workshop on that one, please, on ASHA.
Integration of HIV as chronic disease with aging services, collaboration with local and state aging departments.
Yeah, absolutely.
This is a little bit of a long one, but I love how NMAC describes and details job posting and allows for individuals who don't have a college degree or high school diploma. Maybe NMAC could hold a session for CEOs on how to advertise and create job postings.
Yeah, you know, we believe that life experience, particularly in this epidemic, is almost more important than a college degree. And that if we limit ourselves, we also limit our outreach. And so, yeah, let's figure out how we can address that one. But yeah, it's very important. We also need to talk about kind of what are the expectations around employment. That if you're going to hire people from certain communities, you've got to address your culture to be able to make them be comfortable and want to be a part of your community, or else it's never going to work.
Next one, strategies that certain organizations are using with return to offices and established protocols that can affect the mental health of their employees after being in such a long quarantine. I think that's a major issue more for those who have compromised immune systems.
Yeah, no, but you know, it's also an issue for people who are old like me. You know, the reality is that I am right in that target demographic of who gets very sick by HIV, and I know that we're all very, very worried about it. And NMAC has been having a series of discussions, and we will absolutely talk about that at the conference because we're worried. We don't want to put anyone at risk. That's part of why we went virtual for this year's meeting, because we would much rather meet in person, but we also, don't want anyone to get sick. Yes.
Just a couple more. Telehealth innovation and implementation in 2020.
Okay. Yeah, telehealth, we're all learning how to do this. I did a telehealth doctor's appointment yesterday, and my doctor literally had me put my mouth up to the camera so he could see inside my mouth. I have no idea if that helped. And I'm looking like a fool going, and he's looking at my mouth saying, and do this and do this. So it's a brand new world. Anything else?
One more topic, succession planning.
Yeah. I know staff put that in. So anyway, thank you all. Yes, we have to have that discussion because some of us are getting really old. And it is important that you plan your succession. We've been having this discussion at NMAC, not just if you get hit by a bus, but for some of us, and Tara, how many years have you been at NMAC?
A long time. That's been what I was going on 24 years, I believe. Yeah.
And Allison, total, how many years have you been at NMAC?
I think this makes 15 actually.
Yeah, so I say that to say that, yeah, we are absolutely looking at that. And obviously this is my 31st year at NMAC. So yeah, no, I think it's a real important issue. Well, I noticed that we're getting towards the end of time. And so I just want to thank everybody for hanging in there. There are so many of you who are still on this call. And what you should know is that if there are additional questions, please feel free to email Tara or Allison afterwards. Don't email me, but email Tara or Allison, and they will be able to get to you. Because this is the thing that I think is really important for everyone to know, is that these women who are sitting here, they're the ones who make this meeting happen. They're the ones who create the magic. And if I don't say it enough, I hope they know how much I appreciate all of their hard work and how much we appreciate all of you. This is a new conference in terms of the way we're doing it. It will be a new learning experience for all of us. And we ask for your guidance and for your forgiveness if we make some mistakes through the process. Thank you
Also,
all.
and if you've attended virtual conferences and you'd like to work with us.
Yeah, we're love.
Suggestions. Sure.
Or want to volunteer, we would love that.
Exactly.
But thank you, everybody. Have a very good day. We will be talking. Bye.